The Jela's Development Initiatives, JDI, a non-profit organization, has advocated for mental health care for people living with disabilities, PWDs, to curb depression among youths. The organization's chief executive officer, Mrs. Angela Ocho-Baiye, made the call in Abuja during a meeting to mark the official kickoff of a one-year mental health advocacy project for PWDs.
We have 4 different arms in JDI, but part of what we decided to do for the purpose of this project, the Inclusion First project, was how we could work exclusively with young people living with disabilities and their family members and offering some form of free mental health care. And so the project's background to this is that of stigmatization and social, exclusion that are the major causes that are affecting people with disabilities, which can lead to, of course, different kinds of mental health issues like depression, anxiety, and the rest. Now, what we want to do in JDI is to target young people with disabilities aged between 16 to 25, and we've got 6 categories that we wanted to focus on, and that is those affected by dwarfism, albinism, Hansen's disease, which is leprosy, deafness, and blindness, and those affected with sickle cell anemia. And the location we would like to do this project in are definitely in Lagos and in Abuja. Now, we're not just meeting with these individuals, but equally with their family members. We would like to reach their family members as well.
Ms. Angela Omoro, the Chief Operating Officer of JDI, said the representatives of persons with disabilities were drawn from 6 different clusters: the blind, the deaf, sickle cell warriors, those with leprosy, dwarfism, and albinism.
A lot of times young people with disabilities are excluded from accessing mental health care. So what we'll be doing is organizing group therapy sessions for them and capturing some of their stories through what we call stories from unburdening, and also advocating for their rights and for the inclusion of persons with disabilities in wider society through advocacy work, and of course working closely with the media.
Mr. Kolowale Jayoba from Advocacy for Women and Disabilities Initiative, PWDs, said he was happy to be a part of the program, saying it will go a long way to enlighten women and children with disabilities.
I believe that after the project, the women and girls with disabilities will know more better about their mental health. They will know more better about the relationship between them and their caregivers better, and also the caregivers also need some form of encouragement. The public as well too. That's going to change the perspective of the public towards women and girls with disabilities, and then it's going to make them to see that it's not only a charity view that person with disability needs. What do I mean by charity view? Because most of the time when people see person living with disability, they believe, oh, this person needs 100 naira, 10 naira, or 20 naira, and all of that. They've forgotten that this is a complete human being as well, so that needs so many other things, including mental health. And that's the area I believe that JDI is coming in to address this issue. And it's